Thank you. Good evening, everyone, and welcome to the first of what we hope will be many Alameda County Transgender Town Halls. My name is Jameson Green, and I'm an educator and consultant specializing in transgender and transsexual issues and policy. I'm also the author of the award-winning book, Becoming a Visible Man, published by Vanderbilt University Press, and I'm a speaker at conferences and events around the world. But I was born here in Oakland and have lived most of my life in Alameda County, so this forum is very meaningful to me. The focus of tonight's town hall is access to health care. The topic is one that is discussed daily within transgender communities around the state, and it's a topic that's being discussed more generally at the local, state, and national level, which you can hardly avoid if you're exposed at all to news media. The entire country's healthcare system is of primary concern for a majority of Americans today, and we know that in these 2 hours we can't address every aspect of the problems we face as a nation. But tonight we'll be talking specifically about a perception in this county's transgender community that Alameda County is in a near crisis with respect to ensuring access to low-cost, community-based health care that addresses the wellness and medical needs of this increasingly visible population. We're fortunate to have a wide variety of public officials, community advocates, and healthcare professionals here with us tonight to share their perspectives on this vital issue. Tonight's town hall was planned by community members who are concerned about these issues and want to make sure that our county is one where all of us have the health care we need to fully participate in making Alameda County a great place to live. 3 organizations, the Lighthouse Community Center, Transgender Law Center, and Tri-City Health Center, coordinated the planning process. And I'm very proud to announce that support from the California Endowment and the California Wellness Foundation made tonight's event possible. Finally, I want to express our sincere thanks to the Office of State Senate President Don Parada for making it possible to hold this event here at the Elihu Harris State Office Building. You should have received an agenda for tonight's town hall on your way in, right? Everybody has an agenda. But I thought I would just highlight the order of events. First, we're incredibly lucky to hear opening remarks from some of our leading local and state elected officials. Then we'll hear some statements about what we mean by transgender health care and the health care experiences of a couple of community members. A number of leading healthcare professionals will then share their views on where the county currently stands in meeting the transgender community's healthcare needs and what are some best practices from some other counties that we may want to adopt. 2 of the county's leading transgender advocates will then lay out a plan for vastly improving access to care. And finally, we'll have some time for public comment, which we'll be limiting to about 2 minutes per speaker. So as I mentioned, we are incredibly fortunate to have a number of elected officials here with us tonight. Some of them have let us know that they will be unable to stay for the entire evening, and others who wanted to be here have gotten caught up in budget wrangling in Sacramento. But first, we have Alameda County Supervisor Keith Carson. You can say a couple of words? Say hello.
Well, first of all, again, I want to thank you for extending an invitation and an opportunity to participate in tonight's town hall meeting regarding health care, especially for the transgender community. Many of you know that I was fortunate enough to be the keynote speaker last November at your Day of Remembrance, which was hosted here. And it seems as though we're getting a larger and larger group of individuals coming out to be educated, to be informed, and participate in educating all of us in our community about transgender issues. I want to just be brief about a couple of things, given the fact that Alameda County, or county government, does have the statutory responsibility in state government to provide health care to its residents. We are, quote unquote, the safety net in government. So we oversee health care, social services, and public safety in all of our communities across not only California, but the United States. And I say that for a couple of reasons. One is tonight is so important and vital because many of you may know that as we have scarce resources in all of the areas of the safety net, particularly focused in on the healthcare area, that the ability to use data and information to help in arguing for these scarce resources that really should be provided to everybody is sorely needed. And so this discussion, this debate tonight gives us the opportunity to begin to have that kind of data to add to the mix as we argue for scarce resources that can be provided to any and everyone. I think it is a major move to have the President Pro Tem of the California Senate to even participate in hosting this kind of event here in a state office building. Take that as another one of the major milestones in the continued struggle for transgender rights as we continue to struggle for the continued rights of a number of other people. There are still today 35 states that have no protection for crimes against transgender people. And so for California, and one of the highest ranking officials along with other elected officials to participate openly in this discussion, this dialogue, and this data gathering has to be considered, again, a milestone. We know that the federal government still today does not protect transgender individuals from discrimination in any of its legislation. This is a building block in that regard. The ability to have someone as powerful as our state legislative delegation, and especially the President Pro Tem of the California Senate, along with some of our other federal elected officials, to be able to bring that debate, to argue that effectively with the data and information in our federal House is really important. And you have to look at yourselves as a part of the pioneers in that regard. The other aspect of that is that as we continue to fight for equity and fairness in legislation and inclusiveness in legislation, as we continue to join together in trying to make sure that the resources are available, especially in healthcare, that education, especially in healthcare, which should be a basic right for each and every individual, takes place, that we can't do that in a vacuum. If I may for a second, I guess it was about 8 years ago, and it might sound like I'm digressing, but I want to prove a point. About 8 years ago, it was Forbes magazine, and then later on that same year, Fortune magazine, that did an international study on where is the best place to live and do business in the entire world. The Bay Area next to Singapore was number 2 in the entire world to live and do business. And a lot of that was based on our diversity that we have here in this community, a reflection of every aspect of life. And so as we educate each other, we join together in common struggles. And accessing health care is a common struggle. So I do look forward to participating in not only tonight, and I'll be here for a while, but Amy DeReyes, who is our health care person in our county, will take my place when I leave. But I just want to go on record that as we continue that struggle around access and equal access and education in the area of health care, that Alameda County will stand shoulder to shoulder with not only the transgender community, bisexual community, the gay and lesbian community, but all of our community to access the scarce resources that we have today to provide the kind of health care that everyone should have a basic right for. So again, thank you very much for including me.
Thank you. Supervisor Carson. Thank you. Now we have Berkeley City Council member Chris Worthington.
Well, I'm honored to be here as a part of this event with the illustrious people who are participating. Jameson was phenomenally valuable to the city of Berkeley in helping Berkeley become the first city in the world to train every single member of our police department on lesbian, gay, bi, and transgender issues for a 4-hour training session? 6-hour training session. And so the city of Berkeley is very appreciative to Jameson for helping us to put on this phenomenal training, of which I see some of the other people in the audience as well. So
Thank you,
it's
Chris.
an honor to be here with you as our moderator. Also, Keith Carson has actually been phenomenal in my life. When I was first running for city council, and people were telling me, I was the first openly gay person elected to the city council, people were telling me, oh, your district is all these college students, you know, who are like 18 years old and 19 years old, and they're going to be very stressed out over the fact that you're gay, and they're not going to understand it. And Keith Carson was one of the very few people, now this is only 11 years ago in Berkeley, where we had never elected a gay council member ever. Keith Carson was one of the very few people who said, you know, you're part of our family, follow your heart. And so I deeply treasure Keith for, you know, his concern for all kinds of human rights issues and his incredible leadership on the Board of Supervisors. We don't always have unanimous support for our issues when it comes to the crunch, but Keith has been a very strong supporter, so I'm just delighted to be here with him. And also, Daryl Moore, another one of our panelists joining us, our second openly gay council member in Berkeley. And since we're in a state building, I can't really get too political, but I could say that wouldn't it be really nice if we got our first lesbian or our first transgender person elected? So I'm mostly here this evening to listen and learn on transgender health issues. I'm strongly in support of getting us to change our bureaucracies, getting us to change our prison system, like the fire we passed out at the transgender person who was raped and is being immensely disrespected throughout the entire criminal justice system. And mostly I'm looking forward to learning from the transgender community that's here and supporters. Thank you.
Thank you, Councilmember Worthington. And welcome, Councilmember Daryl Moore. Don't worry about it. You're right on time because it's your moment to say a few words if you're ready. Or if you need a minute, I can.
You have to do that.
Okay, we'll go down the line, come back to you. I just want to let you all know that State Senators Ellen Corbett and Mary Hayashi and Assemblymember, Mary Hayashi is an assembly member also, right? I beg your pardon. State Senator Ellen Corbett, Assembly members Mary Hayashi and Sandra Swanson had very much wanted to be with us, but are in Sacramento getting a budget ready. And so each asked a member of their local staff to fill in for them. And we're very lucky to have Katie Tague from Senator Corbett's office.
Thank you. As they were saying, the senator had wanted to be here very badly with you. She feels very sincerely this is an important issue. And unfortunately, as they were saying, she did get called back to Sacramento to fight for a budget for no cuts to social spending. So we wish her luck with that. And she did ask me to read a statement on her behalf. She wanted to thank you all for taking the time to come out tonight to address this very important issue of access to health care for our community. She also wanted to acknowledge the dedicated advocates, Chris Daly and Cecilia Chung at the Transgender Law Center for getting the ball rolling on the Transgender Healthcare Access Project. We also want to acknowledge and thank Tiffany Woods from Tri-City Health Center in Fremont and Patricia Cavini-Fili from the Lighthouse Community Center in Hayward for their extremely hard work to make this town hall and overall campaign a success. Access to quality health care is a vital issue for all Californians, and Alameda County's transgender community is no exception and should not be. Senator Corbett is fighting for the right for all people to have comprehensive and affordable health care, and that is why she's a strong supporter and principal co-author of Senator Kuehl's SB 840, the Universal Health Care Act. Something must be done because the current system is not working, statewide or for the transgender community here in Alameda County. I want to applaud Tri-City Health Center in Fremont, Highland Hospital in Oakland, and the Berkeley Free Clinic for offering to provide transgender-oriented health services at their clinics, and we hope that that list will grow shortly. I'm excited about participating in today's town hall so that I may hear more about the experiences and ideas of community members and healthcare providers to address the obvious need for transgender-oriented health services in our county. And I thank you all again for coming tonight to share that with us, and I promise I will be talking to the senator about it tomorrow. Thank you.
Thank you, Katie. And Annie Flores is here from Assemblymember Swanson's office.
Hi, thank you. My name is Annie, and I'm the public health field rep for Assemblymember Sandra Swanson. Again, a member, like the rest of the elected officials, was unable to be here tonight. However, he does extend his commitment and support to the access of healthcare for the transgender community. Access and equity have been at the forefront of the bills the member introduced. All his healthcare bills that he introduced this session have been bills that target communities and individuals that live and survive outside the realm of services, both healthcare services and social services. And they're bills that allow them to come back, to be welcome into the services that the state provides, both in healthcare access and social services. We extend our welcome to those who are visiting us tonight from outside the district. And we also extend our office and our open door policy to our constituents who are here tonight. And that you know that your assembly member supports you and is committed to healthcare access for all of us who live here in California. Thank you very much.
Thank you. And from Assemblymember Hayashi's office, we have Chris Parman.
Good evening. I'm Chris Parman. I'm the district director for Assemblymember Mary Hayashi, and she too was unable to be here this evening. She is a commissioner for the Mental Health and Oversight and Accountability Commission that has a meeting in Southern California, and so she's in Southern California as we speak. As many of you know, Assemblymember Hayashi is a friend of and has worked very strongly for the LGBT community on a variety of issues, including health. On the very first day of office, and the very first bill that she co-authored was Mark Leno's marriage equality bill. And for most of her adult life, she has been an advocate for mental health care and suicide prevention through her nonprofit organization, the Iris Alliance Fund, which has previously given a grant to the Lighthouse Community Center, which will be celebrating their 7th anniversary this weekend, so that's very nice. As the Assembly member, though, Assemblymember Hayashi has authored AB 509, which would create the Office of Suicide Prevention for the state of California. This is incredibly important since we know that the LGBT community, LGBT teens, sorry, I'm not very good at reading my own writing, are more than 5 times as likely to die by suicide than straight teens. Her bill seeks to address this issue and provide necessary resources at the state level to prevent such tragedies in the future. As a member of the Assembly Health Committee, Assemblymember Hayashi believes that everyone deserves the right to quality and affordable health care. She is a co-author of Senator Sheila Kuehl's SB 840, and that provides for universal health care. Our office appreciates this collaboration. This is the first of its kind in the East Bay, and we hope to be here to better, to discuss this issue and better understand the transgender community needs, and just want to let you know that you have a friend and a very supportive member in the State Assembly who represents the central part of Alameda County from Southeast Oakland, Hayward, San Leandro, out to Pleasant and Dublin. Thank you.
So, Councilmember Moore, if you've caught your breath, welcome.
Well, first of all, I apologize for being late. The San Francisco Foundation is honoring a group of individuals in my district with Caution Fellowships, which is $300,000 for 5 years, and so I apologize for being late, but I look out in the crowd, what a wonderful audience. It's great that everyone was here this evening. It's terrific. I appreciate the invitation of being here. I just want to say that one of the proud moments that I've had on the Berkeley City Council was sponsoring a piece of legislation that would require the city of Berkeley to offer gender reassignment surgery as part of its health care benefits. And I did this with Councilmember Worthington, and I'm so proud of that piece of legislation. And now we're working with our insurers. We look like the city's going to have to self-insure because the insurance companies are kind of balking and things of this nature, but we're fighting the good cause because it's important that transgender health care issues play an important role in the lives of us policymakers, and that we do all that we can to equal that playing field so that everyone gets the kind of health care that all of us deserve and desire in our lives as individuals. So I'm so honored to be asked to be here this evening. I, too, like Councilmember Worthington, are here to listen, to see how I could be of greater service to our community in providing health care benefits for everyone. So thank you for the invitation to be here this evening.
Thank you, Councilmember Moore. Thank you to all our distinguished guests. We also want to acknowledge a number of people who are in the audience today, very special people. Mona Barra Gibson from State Senate President Don Parada's office. Thank you for being here. And also Ron Person from the Alameda County Office of AIDS Administration couldn't be here, but sends his apologies. And in his place we have Tom Mossmiller from the Alameda County Office of AIDS Administration. Tom, thank you. I also want to acknowledge Sharon Grayson and members of the Alameda County Transgender Steering Committee. They here? Thank you very much. Thank you for coming. Sushi Bree and Steve Kilgore from the Alameda County Medical Center. They here? Yes. Thank you. And Sandra Davis from the California Endowment. Thank you very, very much. Appreciate your support. Also, Oakland City Council member Patricia Kernahan was unable to join us, but she sent a letter of support, which will be posted on the Transgender Law Center website, along with other information about this town hall meeting and our healthcare access project. If you don't know the website address, it's right there in sort of the center of the agenda, the Transgender Law Center website address. Okay, so again, thank you all for being here with us. I'd now like to introduce Joanne Keatley, the director of the newly created Transgender Center of Excellence at UC San Francisco. Joanne will present an overview of transgender healthcare needs and barriers to care.
Good evening. I guess I'll be looking in this direction, and I'll be really speaking in this direction. Thank you for having me here tonight, James, and it's really a pleasure to be here to address the panel members and to address my community. It's really an honor to be here. I am an Alameda County resident. I live in Oakland. I work at UCSF. I'm the previous project director of the Transgender Resources and Neighborhood Space Project at UCSF, and now the director of the Center of Excellence for Transgender HIV Prevention, funded by the State Office of AIDS. We'll talk more about the Center of Excellence later, but in terms of the transgender health, I see it listed on the agenda as Transgender Health 101, and that's not exactly what I came prepared to do, but I will give it my best shot. I wanted to talk a little bit about what are some of the trans health issues that need to be considered. And so I think that one of the things that we struggle with as a community when we're seeking services from healthcare providers are the general lack of information that the healthcare providers have in order to be able to serve our needs. And also, I think that there's a lot of a lack of information and misinformation within our own communities about how to access health and how to treat our own bodies. And so that is one of the big issues that I'd like to discuss tonight. I think that there is a perception of low risk or no risk for some of us around HIV, and that continues to be the case. The data collection that continues to ignore the various transgender identities. I think that HIV has impacted one segment of the transgender community, and as a result of HIV, there have been some resources that have been earmarked to serve transgender populations. Unfortunately, that money only goes so far to serve transgender health care needs. It really is earmarked for HIV/AIDS healthcare services or prevention. And so when we're talking about a huge part of our community, which is the female to male identified individuals or gender queer folks, we still don't really understand what's going on with that part of our community in terms of HIV and how to prevent the incidence of HIV from raising in that particular part of our community. Transgender women continue to be miscounted in MSM categories for funding and prevention programs often. And lots of service providers continue to count transgender women as MSMs. And so that really becomes a problem because then services are either designed to meet the needs of men who have sex with men, and most transgender women don't consider themselves men. And so I think that's one of the issues that we really need to think about. Now, those are kind of general barriers to service that I thought that needed to be expressed. But I also want to talk a little bit about, specifically to Alameda County, about the social and geographic isolation. This county is huge. It's one of the largest counties in California. And it becomes so difficult for people in Alameda County to be able to reach a knowledgeable provider of health care for transgender people. The fact is, there's not a lot of curriculum to address the training needs of medical providers on transgender health. And so what we end up with is having to go into a healthcare setting and educate our providers around our needs. But we're educating those providers on our healthcare needs, often with misinformation that we've either gotten on the internet or through one of our peers who has self-medicated, often with underground medicines that we either have heard that we could purchase somewhere or that a friend has given us. And so our healthcare providers are not provided with the training to really effectively treat our bodies and our healthcare concerns. So that becomes a huge issue. The other barrier to care from a client perspective is the history of bad experiences with healthcare providers. So often we as transgender individuals will seek out a healthcare provider, and then we're shown into a dressing room or into an examination room, and then there's soon a parade of residents, interns, nurse practitioners, janitors. You never know who's going to be walking through that room to see you in the stirrups or in an exam gown that doesn't will probably cover about half of your body. And then, and they have often no reason to be seeing your body. And so it becomes a real barrier to the client who really feels exposed in many ways and really not being treated with respect and dignity. I think the lack of gender inclusive forms, gender choice on those intake forms, the office environment, the alienating processes, the lack of insurance coverage, the lack of reimbursability, the fear of disclosure. Not all trans people want to walk into a setting and immediately be identified as being transgender. It's, you know, being transgender should be, the disclosure of being transgender should be a personal decision. And not all trans people want to walk around in their life experiences with a, you know, as what I say is a T on my head. I don't, I feel if I want to disclose that, then that is my choice. And if it's something that I choose not to disclose, then that should be my choice as well. And then, of course, the fact that transgender-related health care is often explicitly denied in insurance policies, and that is a huge issue. I think the Berkeley Councilman, Darrell, pointed out that you've introduced legislation to include gender-confirming surgeries for Berkeley employees. And I think that I want to applaud your efforts, but I think that also beyond gender-confirming surgeries, that healthcare needs to be looked at as a whole. And there are many trans individuals who are not, in fact, seeking surgeries, but are seeking adequate health care. So for the trans man who continues to have a vagina, then that vagina needs to be treated. There needs to be pap smears available for that individual if, if the person has an intact vagina. So healthcare has to be approached from the body part that needs to be treated, and then whatever surgical processes are included in that insurance policy, that's fine, but include everything else. And provide for mental health care needs, which often are excluded as well in insurance policies. So, at UCSF, we had the leading, the country's leading research project on transgender people, and we had insurance policies that did not provide for health care for trans individuals back in 2000. And so that needs to be looked at. We need to advocate for a total health care package that is inclusive of primary care, access to hormones, if you're seeking them, access to, competent providers of health care, and access to mental health care as well. I'm going to close with some suggestions for making agencies trans-affirming. And so just some brief suggestions. So what are they? Implement gender identity, non-discriminatory policies and procedures. Provide sensitivity training for all staff, front office, managers, security guards, counselors, outreach staff, and elected officials. Make intake forms transgender inclusive. Include name used, not just the person's legal name. That becomes a real problem for trans folks who may not have legal IDs in the name that they're using and living by. So, include gender choices or open-ended gender questions so that the record reflects the person's identity. Challenge transphobia in staff and community. Have trans-inclusive imagery in the waiting rooms. Create safe bathroom policies. We all have bladders, and we all have to evacuate those bladders sometimes. So, so please, make sure that, that basic right to a bathroom is in place for us. And then, most importantly of all, I think, is hire us. There are many of us who are quite talented, educated, and able to, and even if we don't have the education sometimes, some of us can be trained. So please, I just want to make a special plea for that. Hire trans people in the healthcare settings. So thank you for listening.
Thank you, Joanne. We've also asked a couple of community members to share with you their personal experiences with accessing health care. Daryl Ayep and Yavante Thomas Guess. Is Daryl here?
Good evening. My name is Daryl Ayep. So here's my story. When I began to transition about a year ago, I didn't have health insurance and didn't have a clinic that I could easily access for medical care. I learned about hormones from talking with friends and doing independent research on the internet. I learned a lot, some good, some bad, some contradicting each other. I first got my supply of hormones from my roommate. I did not press for details about where she got the meds, but because they seemed legitimate. The pills, I looked the pills up online and they looked like how the pharmaceutical company described them. 2 months later, I ran out of the pills, so I later bought from a friend who regularly traveled to Mexico to buy hormones in bulk. She had injectable hormones, the liquid ones that need to be injected. And I was self-injecting without any training or assistance from a medical professional. I was not getting my blood levels checked at all during this time and was determining the dose of my hormones I was taking based on trial and error. Finally, since I was buying from a friend, I did not have a steady supply and would sometimes have to go without hormones if she was unable to buy any. Looking back, I was very lucky. While I did what research I could over the internet, any number of things could have gone wrong during this time. I could have misdosed or taken hormones that weren't what the label on the bottle said they were. I could have injected incorrectly or caused serious health problems because I wasn't able to get information about how the hormones were affecting my body beyond what I was noticing, beyond the noticeable physical changes. Once I began working at the Asian and Pacific Islander Wellness Center, the nonprofit agency I work with currently, I was able to use my health insurance to see a doctor here in Oakland. I live here in Oakland as well. This doctor had trouble getting my prescription right because of the type of hormone I was using and the various doses that I took. I experienced some physical as well as emotional problems as a result. However, I am now getting great care and taking hormones under the care of a physician who understands my personal and medical needs. I am here testifying today because I want to make sure that all transgender in the county were able to get the quality of health care I am getting right now. I know many other people who have or who are using hormones and are not under a doctor's care. Thank all of you for coming and being concerned about these issues. And I look forward to seeing what we can all do together to improve health care in this county.
Thank you, Daryl. Levante.
Hey, James. Thank you for inviting me. If you haven't noticed already, I'm a trans man. My name is Yavante. I'm one of the coordinators for the new Transgender Economic Empowerment Initiative in San Francisco, but I live here in Oakland. And I'm one of the lucky few. I started my transition back in 1998, and since then, I've always had Kaiser. So I was able to get the mental health care that I needed. I was able to get the hormones that I needed. And I was able to see my doctors at Kaiser work together for my well-being. And I don't know if that's just common, but I know that they made exceptions to making sure that my records were totally available to even my psychiatrist, who normally doesn't see your healthcare records. And my regular doctor was able to see my psychiatric records to make sure I was getting the proper care on my journey to being a well-being, a healthy man. So I'm lucky, and I say that because I know so many people are not lucky. I have friends who buy hormones in the black market, and like Daryl, they're basically doing it on their own because they're either employed or they're on disability, and maybe their disability health care doesn't cover anything regarding sex changes, or even if they don't want to have the surgery, just being along on that route of changing genders. And so I know too that because I never had to worry about it, it was easy for me to become a well-rounded person. I was able to be a productive member of my community and society because that wasn't a big worry for something that was like really big in my life, changing my gender. So because of Kaiser and my network of doctors, I was able to go through and get all my documentation changed. I was able to have the surgeries that I wanted to have at that particular time, and I was able to continue working. On a professional level, my job entails that I deal with clients who are transgender in various stages of their transition. And they don't have it as lucky as I did and as I do right now. Most of them don't know where they're going to get their hormones from, and the ones who are actually taking advantage of the good services in San Francisco, and I'm thinking of Tom Waddell and the Castro Clinic, if it wasn't for those entities being funded by the city, partly funded by the city to take care of transgender people, they wouldn't be my clients. There's no telling where they would be. They would probably be on the street like so many I know, selling their bodies to get their hormones. Because they don't have their hormones, they're having mental issues, which sometimes leads to substance abuse. So it's very important that you all recognize the importance of having this healthcare network available to transgender people. Because I know if it wasn't for my psychiatrist, I wouldn't be standing here. I would have killed myself a long time ago. And so, thank you for giving me this opportunity.
Thank you. Thank you. So our good fortune continues as we have 4 healthcare professionals with us to share their expertise on the healthcare needs of the transgender community, the degree to which the county is meeting those needs, some of the barriers that exist in meeting those needs, and a model for how we can better meet those needs. I'd like to start out with Kim Haraka, a marriage and family therapist in private practice in Alameda County.
Good evening. My name is Kim Haraka, and I am a marriage and family therapist in private practice in Berkeley, and I've been in practice there over 20 years. I'm also an Alameda County resident. And I've been working for over 20 years in my general practice and over 12 years with the transgender community. And I want to speak to you today about the mental health needs of transgender and transsexual folks. Mental health is a critical aspect of overall trans health. Trans people struggle with the impact of living in a culture where they are marginalized and they're not celebrated for who they are. On the provider side, as Joanne talked about earlier, there is bias and there's also a lot of ignorance in the medical community about how to treat transgender people, and there are very few providers who are experienced with transgender patients. The barriers on the client side, there's a reluctance to seek care, often because of difficult experiences with insensitive providers, and therefore there's a tendency to delay care until it becomes an emergency situation. I want to give you a personal example of a woman that I will call Joelle. She is a male to female transsexual who identifies as female. She's been taking estrogen so she has feminized, but she hasn't had access to genital surgery. She's depressed because she's isolated and lonely. She's anxious from not feeling comfortable socially and also not feeling congruent in her own skin. She's come out to her family, but they have rejected her and they don't want any further contact with her. And this has caused her a great deal of pain. She doesn't seek health care because she's uncomfortable getting a physical exam, and she also doesn't know how she will be treated at the clinic. I want to be able to tell her that there is a clinic she can go to where they are skilled at delivering transgender care, where she will be treated with respect and where they will understand her anxiety about getting a physical exam, and they will work with her about it in a collaboration. I also want to tell you about a man I will call Sam. Sam is a female-to-male transsexual. He's been taking testosterone and living as a man for several years. As is often the case, his decision to live as a man was the result of many years of struggle, self-examination, and attempts to try to conform to his biological gender. He was seeking treatment for a long-standing problem with alcoholism, but the treatment program that he went to required that he discontinue his male hormones in order to seek treatment. This was extremely demoralizing for Sam. He fell into a deep depression. He felt so torn between his desire to get help for his alcoholism and his need to express himself by taking hormones to masculinize his body. The reality is that even though Joelle and Sam feel alone, there are so many other people like them. Those who struggle with depression and anxiety, those who have lost friends and family by being out about who they are. Others have experienced substance abuse, struggle with housing and job discrimination, and as well as harassment on the street. It's vitally important that trans people have a place where they can feel welcomed and to get the care that they need, where care is provided in a culturally competent way with providers who understand their needs, where they can be assured they will be addressed with the proper pronouns, treated with respect, and have their needs taken seriously. Even among the trans patients in my private practice, and these are people who are relatively economically advantaged, one of their number one concerns is finding a healthcare provider that they can trust and a clinic environment where they feel confident they will be treated with respect. I cannot overemphasize the importance of having clinics that make an intentional welcome to transgender people. You know, the Tom Waddell and Castro Mission clinics have been mentioned in San Francisco, and people in those places know that they can go there and be welcomed. They have Transgender Tuesday to make it explicit at the Tom Waddell Clinic. They do mental health intakes at the first visit. I applaud this concept of having the Berkeley Free Clinic, Highland Hospital, and Tri-City Health Center have similar programs so that people in these areas know they can get treatment. You know, as has been mentioned, Alameda County is an incredibly diverse population generally, and this is true for the transgender population as well. So it's important to have distinct clinics in different parts of the county serving transgender people. I want to just be assured that people like Joelle and Sam can get the care that they need. Thank you for your consideration in this matter.
Thank you, Kim. Next, I'd like to call Dr. Kathleen Clannon of the Center for Health Training.
Hi, so I am at the Center for Health Training. I see patients at Highland Hospital in the HIV clinic there. And I'm gonna reinforce some of the same points other folks have made, in particular things that Joanne has said. So I'm an HIV specialist. I've been taking care of people with HIV for many years, and a lot of my patients are transgender. I've had yet to have a single class, either in medical school or since then, about how to take care of people who are transgender. So if you're a medical provider, how do you learn about how to do that? Do you learn it in school? It's been a little while, I'm not going to tell you how long, since I was in medical school, but I can tell you that even today, the majority of medical schools have minimal training, formal training about how to take care of transgender people. And certainly the majority of practitioners who are out there actually taking care of folks now have had no formal training like me. Secondly, what do you do if you don't have formal training? You read in the literature. I can tell you it's damn difficult to find published literature that will really give you safe recommendations about how it is to work with transgender folks. That's changing slowly, but much more slowly than we need. Last week, I had a patient that I was working with, someone I'll call Yvonne, that I was working with in the clinic, who we wanted to answer some questions as regards her hormone treatment with her HIV treatment and whether or not those things would clash in a way that would be dangerous to her. And the two of us actually had side-by-side computers, because she was, as other folks said, quite used to looking things up herself. looked for half an hour solid and could not find an answer to the question that we had. So you cannot look find what you need in the published literature. And then finally, where you go to your buddies and the other people that you know who are expert. And so we have in the past actually brought practitioners over from Tom Waddell, for instance, from San Francisco, to help share that expertise. Every time we do that in an HIV context, we get 100 or more practitioners from our area out to hear, because people are hungry for this information. It's really difficult to do that often enough to really make expertise transfer. So we need something like a center of excellence, like Ms. Keatley is going to be heading up here, that goes beyond HIV. The need is great in HIV care, but it really needs to go beyond that to care for transgender people who don't have HIV also. We need that expertise to have a center here. Then secondly, I want to talk a little bit about the struggles that people have. Once they get to us, we're struggling together to try to know what it is to do, and then the barriers that there are actually to just making routine healthcare happen. Does anybody here find it easy to be a healthcare consumer currently? Right. And just as an example, getting medications for people, we all know how difficult it is to deal with insurance. Even if you're not insured, it's difficult to get any kind of medications filled. With my patients who are on hormones, as a for instance, it is a difficulty every single damn time they go to the pharmacy, that we have to go through again the process of explaining to Medi-Cal or to ADAP, the insurance for people with HIV, about exactly why it is that they're getting these medications. And we have to disclose a lot of information that really isn't any of their business in order to get the things covered. So imagine the difficulty that we all have in getting those things, those frustrations of getting those things taken care of for ourselves, and how it would be if you had to go through the process every single time you went of explaining again all the information you explained last time. It's crazy making. So those things aren't necessary. As expertise moves into our community, as it spreads from centers of excellence, then and the care of people who are transgender, with or without HIV, becomes routinized, and we all become we know what it is that people need. We will get to a point then when it doesn't have to be a special case every single time. We know what to do, we know how to do it, and we can get it done efficiently.
Thank you. And now I'd like to invite Dr. Barry Zevin to the podium. Welcome.
Thank you very much. Thank you. I'm Barry Zevin. I have worked in San Francisco at Tom Waddell Health Center for the past 16 years. Tom Waddell Health Center is a community health center and large health care for the homeless program. We're the largest provider of homeless care in San Francisco. I've been asked to speak about how we started our transgender clinic, which we call Transgender Tuesdays at Tom Waddell, and why that model needs to spread to Alameda County and elsewhere. The first answer is there was no magic to starting Transgender Tuesdays. There was a group of physicians and nurses, nurse practitioners, social workers, and community advocates who noticed, gee, we've got a lot of transgender people coming to our health center, and a lot of transgender people who we're seeing in our homeless shelters where we do our clinics. And they're coming in and they're sick, and they've had neglected health care, and often presenting with late stages of illness, whether that's AIDS or diabetes or other medical problems. So, well, let's talk to people. What's the problem? And we heard the same story over and over again about previous bad experiences and discrimination in healthcare facilities, hospitals, and clinics, about not being able to be treated with basic dignity and basic understanding, of being victimized in the community by unscrupulous medical providers who were providing prescriptions for hormones in exchange for money or other considerations without any medical monitoring, or of getting hormones in a black market situation in which they were getting no medical monitoring and often having bad outcomes. We talked to our patients, we talked to our advocates in the community, and we heard the same thing. We need to create a safe place where a transgender person can come to, not be asked to prove anything about themselves beyond that they self-identify as a transgender person, and to be able to provide a comprehensive kind of medical care that would include prescription of hormones, but would also include all of the preventative care needs and all of the medical care needs that that person might have. And then we did the not magic part, which was saying, gee, we know what we need to do, we know how to do this, there's no additional funding, but we're already seeing these patients. And if we reorganize ourselves, maybe we can actually provide something that will work. Let's start a clinic on Tuesday evenings. It is a time when we would expect, we were looking at a homeless population, a population with a large number of sex workers in it. We expect that population to be more available to come to medical care at that time. What we didn't consider and have learned over the past 10 years was the need in our community in San Francisco was tremendous for this kind of health care. Not only did we see our usual population of homeless people and very marginalized, disenfranchised people, but we saw people from all over the city who came with no advertising, with no, just word of mouth, say, there is no other health care for us, can you please take care of me here? Just an anecdote, I'll be the first to say that when we planned this, we said, well, I'm going to skip over the part in the articles that talk about female to male transgender people, because we don't see any of those and they're not out there. Well, from day one, we discovered, oh, there's this incredibly hidden population of FTM people in our community, and they've been even more marginalized and even more discriminated against and not being seen, and we better learn. And part of what we did was very explicitly about trying to use the limited amount of experience and information that was out there in the medical literature and learn from it, and then be able to share that in the community. And we have consulted, taken calls, done trainings all over the country based on our experience of taking care of more than 1,000 transgender people over the past 10 years. And this is not an expensive thing to do. This is not any more emotionally difficult than anything else we do in medical care with underserved populations. It's certainly no more complicated than things that we do in medical care every day. And I do know from our own experience that this can be done in quite resource-poor centers with just support for doing it, a political will for doing it, collaboration between medical providers and administration and community advocates and activists. And I will speak for us at Tom Waddell, we're happy to provide any kind of technical assistance we can, not least of which because we see people coming to us in San Francisco from Alameda County, from other counties in California, from other states and countries, because they've heard this is where that medical care can be. And as San Francisco has gotten more ambitious about their efforts to cover medical care for all uninsured people, we've also seen an effort to really tighten up on, okay, you need to prove you're a San Francisco resident. And suddenly people who kind of said, oh, I'm homeless in San Francisco, oh, maybe I stay with a friend. So, well, where do you really live? And being asked for more documentation, well, not infrequently, the answer to that is Alameda County. And unfortunately, even for those people from Alameda County who we've been able to provide care for, I'm quite sure that it's going to become more and more difficult, even if we have the goodwill to do it, because we're getting to be in a situation where there's bureaucratic barriers that are being imposed that say we really can only provide care to San Francisco residents. And I really don't want I want people to have an opportunity to get the medical care that they need, and it can be done. So, thank you.
Resources are scarce in Alameda County, but the staff at Tri-City Health Center has done a tremendous job at reaching out to the community and has had a very successful outreach program. We have several transgendered staff members, and the program staff have worked together to eliminate a lot of the barriers to care, and we're continually working to do that. We've tried to make the environment in our clinic welcoming and non-threatening in a variety of ways. For example, we have a transgendered receptionist who is the first person who patients see when they walk through the door. The transgendered staff teaches the clinical staff on a daily basis about what it is like to live as a transgendered person. Since I started working at Tri-City, I've learned a lot from the staff. And like most providers, my educational program didn't prepare me to work with trans-specific health issues. I've had to rely a lot on the people who I work with to teach me about trans care. But perhaps most importantly, I've learned a lot from my patients. And my patients have taught me about transgender issues, and I've learned that I can really just not assume anything. I remember in 2000 when I was fresh out of school and my first transgender patient wanted hormones, and I remember how anxious I felt about refilling her prescription, but I wanted to help her, and so I was motivated to learn more about transgender care, but I was frustrated by the lack of clinical resources and clinical references. So I was honest with her and told her that trans care was not my expertise, but that I would learn. And I think she appreciated the honesty, and it ultimately formed a closer bond between us. To this day, I try to remember the lessons that I've learned along the way in the past 7 years, and I might not always have all the answers, and I do have to rely on other providers who have more experience than myself. But what I'd really appreciate is access to continuing health education to give not just adequate, but really expert care. And hopefully that will help Tri-City so that it can continue to grow its transgendered program. Thank you.
Thank you, Ms. Murphy. So to conclude the formal portion of tonight's town hall, we have two women with whom I've collaborated for many years and whom I greatly admire, Tiffany Woods and Patricia Kavina-Feely, each of whom has been working for nearly a decade to make Alameda County a place where our community can safely live, work, and thrive. They are going to share some common sense ideas about how we as a county can improve access to health care. Tiffany Woods.
Thank you,
from the
James.
Tri-City Health Center.
For those of you who don't know, I'm one of the consultants on this healthcare access project, and I want to extend my thank yous for being here to the panelists, representatives. Thank you so much for taking the time out of your busy schedules to listen to us. And more importantly, thank you, everybody that is sitting in a chair. You rock, you're here. I'm the community organizer, means getting trans folks and supporters to a meeting. I think I got the shaft, but if I hear one more trans person say, well, I got class, I don't know, I'm working, you're here, and it's about those that are here tonight. And thank you so much, because if it isn't for your visibility, we have nothing for them to see us. So I really respect that you're taking that time out to be visible tonight. So I get to talk about, with Patricia, a vision for moving forward, and I'm really excited because usually in the trans community, we're taking many steps back, either on our own or being pushed back. And so we're gonna be on a positive note tonight and talk about moving forward. So we have three things. I'm gonna speak on the need for training. We're gonna have a 5-minute example of a training video put together by a wonderful community member, and then we're going to move on to investing into transgender healthcare. So let me highlight a couple. The need for training on moving forward. The County of Alameda and cities within Alameda County have taken a number of very positive steps in recent years, and some of you might be aware of them and aware of them and probably participated in helping these happen. Ordinances in Oakland and at the county's Board of Supervisors banning discrimination of transgender people. Fabulous. about time. One of the few in Alameda counties to do that. Very progressive us here in the Bay Area. Recent steps taken by the City of Berkeley, obviously providing health insurance equality for all employees. We have a creation of the Transgender Steering Committee in Alameda County to help advise on transgender issues and training. We also have our county diversity trainers have already been trained on transgender issues. So we are moving forward. So what's the next step? The next steps in that effort should be trainings for all health care providers in the county. Let me say that again. Trainings for all health care providers in Alameda County. Yeah. Are we clear? Did I stutter? This is critical in providing competent transgender health care. It really is. It is huge. As you have heard here tonight from testimony, and you will hear from community members during public comment and supporters, providers need to understand that issues that affect transgender people, healthcare needs, go beyond just access to hormones. It's not just about handing out hormones. It's very comprehensive. And so a training will help identify those issues. In fact, at Tri-City, we've already have been in the planning process of doing a training for the Alameda County Healthcare Consortium on transgender issues. So we're really moving forward. So a number of providers have already received training. So let's complete it. Let's finish. And here's some steps that we can do. We've outlined them. Explain the value of a training for all providers. I don't even need to know that that needs to be expanded on. If they don't get it, they need to get it. And being in an exam room when you have a health issue and you're in pain or you're stressed out is not the time to be explaining to your doctor or physician's assistant or NP that walks in and going, so transgender, what exactly is that? While you're sitting there with a prostate infection or a broken arm or an abscess or something. That's not the time. It's a little late. And part of that value is understanding that if I have high cholesterol, which I don't, it's a nasty rumor, somebody tarted. There's a variety of reasons I have high cholesterol, and transgender is not one of them, okay? It's because of my mama's side of the family and a little bit of fried chicken going on. And diet and exercise are really good. Scope of training should include doctors, physicians' assistants, nurse practitioners, nurses, frontline staff, administrators. I could go on. Really, anybody that's going to have contact with that transgender client or patient should have some kind of training. And that includes the security guard. It really does. Because a lot of people, when they walk into a waiting room and you're already dealing with clients who might, be tripping, and then you have a security guard making comments before you even get to the receptionist desk, they're going to turn around and walk out and leave. So everybody needs to be included. Do an assessment of which county providers have been trained. Very simple, because there has been a lot done. Determine how remaining providers will be trained. Again, that can be easily done. Number 5, make sure to include mental health providers and all John George staff. Okay? Mental health is a key component of all transgender health care. And it's one of the few huge lacking resources in this county, as Kim testified earlier. 6, determine a way to make sure that turnover within an institution doesn't negate the large-scale trainings that have already been done. If staff are leaving, make sure that we revisit a training in a year or two. Just because we've done one transgender training a year ago, it's just like anything else. There's new stuff going on, and we need to update the new staff. So those are some key steps that we can all do. And I just want to also plug that Alameda County has a wealth of talent. And we have San Francisco right across the bridge and Contra Costa. Try to find trainings and talents at least within our county first, as well as San Francisco. We have so much knowledge and we're willing to share. And look at everybody in this room. Trans people will tell you more than anybody else what to do, what to say, how to address, but they're not asked. Ask us, we'll tell you. And when we actually get an ear to tell you, we'll tell you more. You'll find, say, okay, I got it, stop, shut up, no waiting room. All right. At this point, I want to introduce a very talented filmmaker student / whatever. He says, don't make a big deal. But this is Ethan Sunnywick made a training video. It's a transgender cultural competency video for medical providers. It's very user-friendly. You can get a copy of it by seeing Ethan right here. And Cecilia, you going to run this? It should be all set up. And so please, this is a little 5-minute on training providers and can be used in a variety of contexts.
one time in particular where I went to get STD testing, and the woman was like, I've never met a transgender person, ever. I don't usually work at this clinic. I do pediatrics. I don't know what to do with your body. Like, you know, if you were a guy, I would just have you stand here. If you were a girl, I would have you lay down on the table. She's like, but I don't know what to do with you. And she was perfect. She was like right up front about it. And I was like, and I didn't know what to say. Like, I was like, I don't know how to do your job. I don't know what you're looking for. I don't know what you want me to do. And she didn't know what to do either. So we were just kind of like, take this. And then I left. And I was pissed that I didn't get health care. I didn't receive any health care.
I always knew there was never any question for me as to maybe I'm this, maybe I'm that. Even though as I got older, my body was different from what I had imagined it to be. In my mind, I was always a little boy, and I was always treated like a little boy by just about everyone in my family. I became aware that I was different when I was probably about 2 years old. I've always identified myself as being female in spirit.
I identify as transgender. I actually don't necessarily identify as male or female, but I definitely move more towards, like, if you want to call it a spectrum, but more towards the masculine identified, but not necessarily as one or the other. I remember when I was like about 3 or 4 years old, growing up in Louisiana, I got like a great bowl cut and was walking around, and everybody kept asking me if I was a boy or a girl, and I would answer as a boy. And then I think that kind of threw my mom off, so she kept putting dresses on me.
First, I wanted to be a woman. Then I realized that I could never really be a biological woman. And then I came to the other side where I realized, why do I even have to be? And finally, I realized I'm a transgendered woman, and that's great. I think there's nothing wrong with me. What's going on here is that something's wrong with the world.
I think transgender people in general are very fearful of going to a medical provider. It's very vulnerable. You don't know if you're going to be flatly rejected, or someone's going to laugh at you, if someone's going to over-sexualize you, if someone's going to want to do an exam just to see your genitals, just to satisfy their own curiosity. There are lots of humiliating experiences that people have, and those get shared with other trans people, and people end up avoiding their medical care altogether.
Myself, I went in once for, what did I have? Bronchitis. And I disclosed that I was transgender, and the next thing I know, I'm in the ER. I went to the ER for services because I had a high fever, and I didn't feel comfortable in going to the doctors regularly because there was nothing trans-specific here. And I ended up under a spotlight with my legs wide open and a group of doctors looking at my vagina because they all were curious to understand what my body looked like. But I initially went in for bronchial stuff. So there's no congruence there for providing care.
So it had been a while since I gotten the junk checked out, and I really felt like I needed to get like an annual in order to just do my own kind of health maintenance. I was waiting for a while, and the practitioner came in, and she's like, "Oh, how long has it been since your last exam your last pelvic exam?" And I said, "Oh, it's been probably like over 10 years maybe." And she's like, "Wow," she was astounded. And she's like, "Well, welcome back to being a woman." And I was like, I was a little bit taken aback. Like, I feel like in that case, she assumed that her identity as a woman was going to be my identity as a woman just because I was in that clinic and getting the particular exam that I was getting. But that's not true. You know, I can identify as I want to. I can identify as transgender. I can identify as male, and I can still go in and get that exam. I can still have a period, but I'm still male. I'm still transgender. I can be whoever I want. So don't place your identification with your gender onto me.
Every single time I go to see somebody, I have to come out, and then I have to educate them on what I'm talking about when I come out. The assumption is that if I say I'm a transsexual, then I must be a male to female. And the first is, well, you know, why don't you try to talk a little higher so that people, and you should get that stuff off your face. I mean, who's going to believe you? And you don't sit dainty like, what? I don't understand. So then I had to explain the existence of FTMs. And then I had to explain that we aren't all doing certain things. I remember one time I had pneumonia, and the x-ray tech kept, I don't know how, because he had to read my file. And he started asking me questions. First of all, he started saying Miss Lewis, and I said, it's not Miss Lewis, it's Mr. But then also asking me a question, so you're taking testosterone, and what effect do you think that might have had on your pneumonia? And me saying, none. I don't think it had any effect.
Medically, to provide cross-gender hormones is incredibly simple, but transgender people don't just need hormones. They need full-scope medical care just like everyone else. And if they take hormones, it doesn't mean that the rest of their lives are any more complicated from a medical perspective. And we should stop being so afraid to address transgender people's needs.
So that's all the time we have. That's a little teaser. And if anybody wants a copy, either see me after, and if I'm not around, I'll leave a stack of flyers at the lectern that has contact information for me. And have a great Wednesday.
Thank you. Patricia Cavina-Fili from the Lighthouse Community Center.
Well, first let me say what an honor it is to be here and see this day come to pass that we've been working on for so long. I really appreciate honored panelists, community members, guests, friends, and allies. You all are so important to this process. Well, my role here is kind of a now what. We're ready to invest in healthcare. But let me summarize for a moment where we are. We're at the point where we've been learning about the obstacles to healthcare. About half of transgender people don't have medical health care, don't have mental health care. And we've heard about the obstacles, the fear of lack of cultural competency, the need for cultural competency, the training that has to happen, the issues, other issues that impact transgender people that indirectly impact their health care when they have trouble finding work, finding housing. And I would really like to honor Supervisor Carson's office because they were the sponsor of the gender identity resolution for Alameda County. So we all need to really recognize the leadership that Supervisor Carson's office has provided our community. We've gotten to a situation where we've heard some of the providers talk about some of the issues they've experienced and some of the things that, that have happened. We've heard from community members talk about some of their issues. So here's where we are. We're at a point where now we have to develop a plan. I hope everyone in here realizes this town hall is not the pinnacle of everything that we're doing. It's a beginning. We're at a beginning. We're at a beginning to keep developing our relationships with providers, community members, and we need everyone's input still so that we can develop the models in Alameda County that serves everyone in north part of the county, Berkeley, Oakland, in the south part of the county, Hayward to Fremont. So what we want to do is to develop a plan to provide culturally competent health care to low-income, uninsured, and underinsured residents of Alameda County who are transgender identified. Healthcare providers, including Tri-City Health Center and the Berkeley Free Clinic, are considering options to expand their current services to include a larger focus on transgender health, and we are very grateful for that. We want to continue this process to identify more providers. We've had productive conversations with Dr. David Altman, the Chief Medical Officer at the Alameda County Medical Center, and members, and we've had acknowledgments of people from his staff that are here today, and we're happy about that, but about opening some clinic hours. And one of the things that we talked about with Dr. Altman was increasing cultural competency. Because ACMC, I mean, let's face it, in this county, they're the center of healthcare here. We've had productive conversations with Dr. Anthony Eiton, who's now the Director of Public Health for Alameda County. And what was a surprise to us and a delight was to find out that he spent 8 years with Dr. Zach. So to know that he was very open to what we're doing. So what we want to do is that between these institutions, we want to create a network of providers from public and private institutions that serve transgender people in Alameda County. And it was very gratifying to hear the commitments that the panelists have made to continue this process. And believe me, we will continue our conversations with you, and thank you for that commitment. So the next step is we're investing in healthcare. So fundraising is always a nightmare, and we're in a very difficult budget period now that that we all know that. And we're recognizing of that. We're recognizing of the reality, but we also want to move forward with a plan so that recognizing the reality that we're still able to move forward and do what needs to be done. So we want to get some planning money between public and private entities, so this planning could determine the medical and mental health needs of transgender individuals, to allow the providers a mechanism for how the network will function and help plan the ongoing collaboration. Small planning grant should not take that much, but we will continue to ask our friends in the public and private sectors for their help, and we will continue to look for help elsewhere. At the same time, we still need community members to step forward to talk about the efforts that we're doing. We're not passive players here. For this model to work, we all have to be involved. So dependent on the network, the planning could then create, for instance, a 5-year implementation plan for slowly expanding services to meet the needs of the transgender populations in both medical care and mental health care, and to increase the cultural competency of the services provided. So funding is challenging. I was told as a minister in training, always tell the truth even if it hurts. We will be seeking commitments from both public and private sources, first for planning and second for implementation. And a number of private funding sources have shown interest in expanding access to health care for transgender members and could be approached as partners. But the commitment is key. For this to happen, we need to be able to move forward as partners. Obviously, investing in transgender health care has benefits. Because if you're, as has been stated earlier, if you're dealing with the prevention of health care, you're having less people who are transgender go to the emergency rooms, go to the hospitals for surgeries when things have been too late, for dealing with HIV care before it's too late. So these are things that impact every community, and we just have to include transgender health care as well. I also don't want to be missed what was stated earlier about finding data to actually ask the questions that will discover if transgender individuals are HIV positive, are a high risk for various medical care issues, are at risk in terms of mental health issues, and also the research that happens. When that happens, then the floodgates for funding will help open, and then we'll be able to do more. But we need everyone committed on that. We need the state committed, we need the local entities committed, and we've also had conversations with Barbara Lee's office and Pete Stark's office, and they've given us their support for that as well. So, in the end, we will be creating a model that's proactive, a healthcare model that includes private and funding sources and resources. In conjunction with community leaders and organizations, we will be communicating, and this can't be understated, we will be communicating to transgender individuals and communities that they matter. Their healthcare matters is clearly the right thing to do. Thank you.
Thank you, Patricia. So we have just about 20 minutes left, and we would like to invite any of you in the audience to make public comment. Your presence tonight is extremely important in letting our public officials know that this matters to more than just those of us who visited their offices. If anyone who wants to comment tonight, please line up to the left here to speak at the podium. And our air traffic controller here is keeping everything in line, keep you all in line, okay? If you like, you can say your name, and if you reside in Alameda County, that would be nice to know. Because we want to hear from as many people as possible, we ask that you limit your comments to about 2 minutes at most apiece. So.
Thanks. My name's Hale Thompson. I'm a resident of San Francisco, but I've been a member of the Berkeley Free Clinic for about 4 years, about as long as I've lived here in the Bay Area. Thank you for this opportunity to share with you what we've been working on at the Berkeley Free Clinic. I want to give people a little background about the clinic. Berkeley Free Clinic's been providing basic health care to underserved communities in Alameda County since 1969. It's a clinic with a really strong infrastructure that's made up of community-based, all-voluntary lay healthcare workers, and we all practice under the expertise of licensed medical professionals who are also volunteers. The clinic is run on a really strong philosophy of collectivity, democratically run, democratic decision-making, and a philosophy of community empowerment. So I feel like this is particularly unique and advantageous for the transgender community to really take advantage of this model. What we've been doing is generating community interest and support, and we have a lot of support as well as talent, people who do have experience in healthcare. And we have doctors on board as well, and nurses, chiropractors, etc. And we also want this to be community driven. So transgender people are planning this clinic and will be running this clinic. And so not only will it increase access for transgender folks in Alameda County, but it will also increase opportunities for job training, skills building, career development, and so they can get hired at the Berkeley Public Health Department. And it will also help improve the health of people, especially when you know you're going to a safe place where peers are going to be serving you and taking care of you. So we want to keep that momentum going, and we encourage increased community participation. So come see any of us. We're all sitting in the back. Thanks.
Thank you, Hale. Who's next? Who's next?
Thank you everyone for showing up tonight. I appreciate the support. My name is Josie. My travails through the healthcare system are too painful to recount. I can share a few of the low points and the high points. But basically, 2 years ago I was an electrical engineer, and today I'm disabled as a result of what I've been through in the healthcare system. So, what I've experienced, and the lowest of the low part was being abandoned by my surgeon, being left without any access to a doctor, and turned away from the hospital, and having to travel thousands of miles to find replacement care. In the process, I was terrified I was dying. I then found that as a male to female transsexual with chronic health problems, with disabilities, and with a collapsing financial infrastructure around me, doctors started to lie about me and my medical records. They started to say things that were not true and argue with me about them. In fact, before they even wrote these things, apparently they had already decided what they were going to say about me. It's been a very difficult thing to deal with. The high point is that we're all here today and trying to do something about this dreadful state of affairs. It's not just me. There are many people that are just not even willing to talk about what they've been through because it's been so awful. Another high point is going into the Tri-City Health Clinic and being greeted by Brenda. That was a wonderful experience to actually go somewhere and see that there were people in my situation who were actually doing their best to make a difference, to make a place for us. I hope that the momentum that we have going here is going to carry through, and that there will be some significant changes. Because I can express to you from my personal experience, the untold suffering is much greater than anything you'll ever hear about. Much greater.
Thank you very much. Because of time constraints, we need to ask you to keep your remarks as brief as possible, as close to 1 minute as you can. Okay. Sorry.
I'll try to do that. Thanks very much. My name is Carrick, and I'm fairly fortunate. I was lucky enough to move to the Bay Area in 2005 for school and for graduate school at JFKU in Berkeley. But even though I was going to school in Berkeley for the first year that I lived in the Bay Area, I lived in San Francisco, sleeping on my uncle's couch because, of course, I can't afford a place to live in San Francisco, just so that I could go to Tom Waddell and make sure to be able to attend the Transgender Tuesdays there. At the same time, I was often, when I would come into Berkeley for school, I would stay with friends over the night and maybe the next day use the library and then come back into San Francisco. A little bit kind of taxing that way. In March of 2006, my uncle's apartment building burned down on Twin Peaks. And so I was living with friends mostly in Berkeley, and I kept attending Tom Waddell for about another year because I wasn't able to find out any other place that I could go. I was trying to investigate resources in Alameda County. There didn't seem to be anything here. The information about San Francisco mostly seemed to focus on Tom Waddell and other, city and county clinics that saw people in the city and county. And if I asked the people at Tom Waddell, I was afraid that I would lose my care. So I would call or email, but not talk to my actual providers. But I could never get through to anybody on the phone, and nobody ever answered my emails. So for months, I was without care. My classes were on Tuesdays. during the clinic hours. And anyway, I couldn't prove my residency, and people were starting to ask questions because they'd observed that my apartment building had burned down. And I just couldn't find out where I could go. So when was it that I finally found out about another clinic that I could go to? About a month and a half ago, because I was participating on the Community Advisory Board of the San Francisco Department of Public Health Office of AIDS Research, and someone there had a brochure, had a pamphlet of trans resources that was left over from 2 years ago or so that isn't being funded anymore, so it can't be published anymore. But that's where I found out about Lion Martin, and so now I'm getting cared there. And it's lovely. It's great to have a place that I can go where I feel welcome and safe. And I'd really like to see that kind of resource here in Alameda County so that people don't have to go to San Francisco and tax their resources there, because they're really taxed there. Thanks a lot.
Thank you. Thank you very much. Next up.
Good evening. My name is Layla, and I'm in Alameda County. I was born and raised. I'm a little nervous to speak in public, so just bear with me. I'm a transgender woman born in Oakland, born and raised in Oakland, and it has been very difficult as I choose to transition from male to female. Part of it is family support, health services, not having the right guidance that is needed in order for, as a transgender, to do it right and not make a mistake about it. It's the lack of services in Alameda County. Part of it is housing. Kind of nervous. Housing is one of the major issues that's affecting the transgender community. Why I say that? Because I live that. Because of not having my family support. So therefore, as of that, it comes down to other issues such as health issues, HIV and AIDS, having the wrong type of hormones that affect your health, not having the proper clinics to go to. I think I got a little lost. I just want to be heard. And the transgender community needs to be heard. Right. And it's a lot of people that's here now, but it's a lot more people that's not here, that needs to be here, that needs to speak up. They just don't feel supported, don't feel backed up like somebody can actually hear them and actually respect what their needs. So just listen.
Thank you.
Hello, my name is Stephen Thorne. I am a resident of Alameda County, a resident of Oakland, a homeowner in Oakland. I pay my taxes, including property taxes in Oakland, and I vote in Oakland. I am a transgender person, a female-to-male transsexual. I work for the city and county of San Francisco, and I was one of the people that was very involved in changing San Francisco's medical insurance policies from having transsexual treatment exclusions in all of our insurance policies to having all of those exclusions from every provider be dropped and have transsexual treatment, medical treatment, now covered for all city and county employees of San Francisco. It has made a very significant change in my life to be able to access medical care and be able to utilize my insurance for all of my medical care and medical treatment. There are many, many horror stories of transgender and transsexual people who have been denied not only care for their transgender particular medical issues such as hormones or surgery relating to their transgender status, but also being denied even life-saving medical treatment that didn't have anything to do with their transgender treatment or transgender care. So it is a very important and very significant issue. I applaud the city of Berkeley for making progress and making moves to ensure your employees and drop the transgender exclusions from your medical providers. We have Kaiser, we have Aetna, we have Blue Shield, we have HealthNet. They have all provided it for San Francisco. They can all provide it for Berkeley. I don't know what the status is for the city employees of Oakland or for the county employees of Alameda County, but if you do not ensure and not exclude for the city of Oakland and the county of Alameda, that is not okay. It needs to be changed, and you folks are some of the key people who can make that happen. So please do it. Thank you very much for your time.
Thank you, second. We're running out of time. We got 2 minutes.
My name is Hav Doherty. I'm a resident of Oakland, and I work in the city of San Francisco. I work at San Francisco General. I wanted to just share a little bit of personal experience to indicate to the panel that transgender people will do what we need to do to get services, and sometimes that means going to great lengths. I was one of those people who showed up at Tom Waddell claiming not to have an address to get services about, I don't know, it was probably over 10 years ago. And it really set me back on my heels because somebody sat me down and said, "Do you have health insurance?" And I was like, "Yeah." Of course, I had no clue where I could go with health insurance to get services. But they said, you know, if you avail yourself of the services here, you're depriving somebody else who doesn't have health insurance. So let's think about that and think that through. Now, I was fortunate. I had contacts in the community. Somebody directed me to a knowledgeable provider. Even so, there have been incidences with my current healthcare provider where there's a lack of competent treatment because staff was not aware. So these needs are very pressing. You know, I'm a privileged person, like I said, employment, healthcare, insurance. I had to go to Canada for surgery. You know, it's a shame that a person who has to go outside their community basically for healthcare services under these conditions. So again, I urge you to do everything you can to make these services available to folks who need them. Thank you very much.
We'll go until 10 after 9. That gives everybody here.
Briefly, I just want to thank all of you for being here. I work for Bonita House, which is a integrated dual diagnosis treatment center here in Berkeley and Oakland. And I, too, was at Tom Waddell Clinic in 1994 with nowhere else to go. And I just want to say that it shouldn't happen again. It shouldn't happen to anybody, that we have no health care and no choice and have to lie about where we live in order to get services. So thank you for doing what you're doing and keep on going.
Thank you.
Thank you for being here tonight. I'm Juan Barajas. I'm the Executive Director of Pacific Center, which is the LGBT community center in Berkeley. Our largest program is a mental health clinic, and we also host a range of support groups, 2 of which serve folks that are transgender, gender variant, and genderqueer. I wanted to share with you that in our services, we've actually had an increase in the number of trans folks accessing our mental health, but unfortunately what that means overall is that we have a wait list for our services the majority of the year. We work with interns and a lot of volunteers to provide services, but I would strongly encourage and advocate for more funding for planning and for actually providing services that are transgender and LGBT overall competent for the mental health needs of our community. So I'm really happy this is being organized tonight, and you have the full support of Pacific Center behind any efforts going forward to increasing healthcare access here in the county. Thank you.
Thank you,
Hi, I'm Lucia August. I'm a healthcare provider, mental health care provider in southern Alameda County. I've worked in the field since the middle 80s, and I've had a private practice since about 1989. And transgender people just sort of found me. I want to echo what was said earlier, that I had absolutely no training in graduate school as a psychotherapist in dealing with trans issues. People found me. I've been working with queer people for a long time in my private practice, and so transgender people started showing up. And so I had to start doing independent research and attending workshops on my own, and one with Jameson Green and a variety of people around, and connected with a group of other therapists working with gender issues, and I do my own independent research. So I really want to put a pitch in for more training, county-sponsored training for mental health practitioners, because there's a tremendous amount of people who don't know a thing about it, and I hear horror stories from my clients who come in who drag themselves in because they've had terrible experiences with other therapists. Thanks.
Thank you so much.
My name is Nasra Nicola. I'm originally from Oakland, although now I'm a graduate student at the University of Chicago and the chair of the Queer Grad Students organization there. As a non-trans person, mine may be the least important voice you hear tonight, but I do come with a message. Think about the number of transgender people who are in Alameda County and then multiply that number by approximately 2, not counting single people. And that's the number of people who are affected by transgender healthcare access or lack thereof. If my partner, for example, doesn't feel comfortable getting screened for STDs, the only way we will discover if there are STDs in the family is if I get one. I myself am uncomfortable seeking gynecological care because I have 2 choices. Either the straight doctors who will insist that I can't be having sex with a man without risk of pregnancy, or the lesbian doctors who insist that I'm having sex with a woman. Neither of which are true. I've had to change mental health care providers several times and eventually start lying to my mental health care provider to stop them from either mispronouncing my partner or implying that any problem I have is due to dating a trans person. Because clearly the crazy is contagious. If transgender healthcare access only impacted trans people, that would be reason enough to make it effective. But the fact is, it doesn't. And the problem is much more widespread than people even begin to imagine.
Thank you. Very important voice.
Hi, I'm Tanaja. I am with Trangender Healthcare. I'm a health education coordinator. I'm just here to give a voice for the African American transgenders, and the money is needed for the programs and the trainings, and just to make sure everybody understands what we go through and what we need to fully transition. So that's it.
Thank you.
Hi, my name is Brandy Martell. I'm part of staff at Tri-City Healthcare. I want to say that personally, me myself, I never had a problem with healthcare or family rejection and all that, but I know a lot of my friends and stuff that have been rejected and haven't been able to get hormones, and they have to resort to going to Mexico and sneaking back with the hormones and all that, and you know the dangers and the side effects going along with that. But I want to say that our staff at Tri-City, we're doing a lot to help, but we just can't do it all, so thank you.
Thank you.
Good evening, I'm Marcia Martin, and I'm program coordinator for Get Screened Oakland. It's a mayoral initiative to encourage and hopefully invite all Oakland residents to learn their HIV status. And 2 things I want to say. Number 1, I want to say the postcard worked because I learned about this meeting by getting a postcard from somebody.
Great.
So that really matters, and Get Screened Oakland has its own set of postcards that describe all the spots where people can get HIV tests, rapid tests. And I'm bringing that up here, and I wanted to be here tonight really once I learned about it, because I come from Washington, D.C., and Whitman Walker Clinic runs a transgender health clinic, and the statistics that they have on their male to female transgender population in HIV and STDs is at 39% positivity rate. And so I would just, D.C., we've got a high rate of HIV, so you can't put that anywhere except for, although the HIV among transgender population is much higher than any other population in the city. And so I would just ask you all to help us on the city side to reach as many folks and encourage as many people to get screened for HIV. And that will also help us begin to change the healthcare system, because some of the very clinics that you're talking about are clinics that have signed on to help us expand screening and knowledge of HIV. And so we're going to be opening up a full office under the mayor in about another month, and we would love to partner with leadership from the community to make sure that our HIV program in the city of Oakland is as inclusive as it can be. So please take some postcards, get them around, and encourage everybody to get screened for HIV. And if it doesn't work, let the mayor know. Thank you.
Thank you very much.
Hi, my name is Robin. I've been a resident of Berkeley and Oakland, and I was one of those Alameda County residents who was turned out of Tom Waddell Center. And while I was waiting for my referrals, which ended up being mostly in the city, I remember breaking down in the waiting room. And I know that that would not have happened if there were a transgender clinic in Berkeley, particularly at Berkeley Free Clinic. Not only because I wouldn't have been turned away, but because Berkeley is my chosen culture, and I'm more comfortable here. This is my community. Thank you.
Thank you very much.
Hi, my name is Charlene. I was born as Ruth, and I'm a member of the intersex community. I just wanted to point out that that is the first time that this word has been used in this room today. I would like everybody to remember that we are part of the transgender community, and that we were once 6, and now we are 2. 4 decided to take suicide as the only way out, because that's how obscure psychological and physical health is to the intersex people. Thank you.
Thank you very much. We have one more speaker.
I'm Lisa Carver, and I'm the HIV program manager at Tri-City Health Center. And I just wanted to say that it's very, very important that this not be the pinnacle, as PK said. But I also don't think that we can wait 5 years. And so there are a lot of things that healthcare agencies can do right now. And so I'd also like to see some of those things happen. At our agency, we were able to do what we're doing through creative use, and it's not even that creative. I mean, we have to remember that there are a lot of government programs that pay for health care. Not a lot, I don't want to say that. There are some that can be used creatively to assure that everyone gets care. And it's important for community-based health centers and other providers to remember that. Training can start happening now. A lot of things can start happening now. And I sure, based on our experience with Transvision and with our clinical services, I sure don't want to wait anymore to see something start happening, because there's a lot of days when we go home, us that work at Tri-City, where we just feel a lot of despair at seeing people who haven't had anything for so long. And it's really hard to fix things when people have already been so long without anything. So let's start now.
Thank you. I want to thank you all for attending this important town hall meeting. Hopefully we can do another town hall in another part of Alameda County in the not too distant future, before too many months go by. This is an ongoing community organizing project. It was community members who put this event together, and we can certainly use your ideas and energy. I also want to, before we close, I want to be sure I thank Brandy and Tanisha for staffing the check-in table tonight. Yeah. Now, if you want to participate in this effort, if you want to help, if you want to keep this all moving, I hope that you signed up, got your email address or phone number on one of these sheets that were out on the table. And if you didn't, be sure you do on the way out. And that way we can keep you informed. And also check the transgenderlawcenter.org website and speak out among your friends and associates to let them know about this effort. Together, we can make quality health care access a reality in Alameda County. Thank you. Thank you very much.
And I'd like to keep your hands together for James Green for moderating this panel tonight. We're so happy to have you here and all your esteemed talent. Thank you. You did a great job. We have to be out of here in like 5 minutes. Everybody get out. No. Please help
wants to
clean
help
out.
help
And
clean up.
schmooze, you can schmooze and network out the building, but we're